Okay, I want to warn you. We're about to talk about something that is very boring. We're going to talk about insurance and we're going to do some math. However, this is something you need to know, and in an effort to make it more exciting and more entertaining, I'm probably going to get a little angry and I'll talk louder because insurance sucks. Get ready. So you've been warned, right? Now, before we get started, a couple things. One, this is not an endorsement of any sort of health care. This isn't about Obamacare. This isn't about Medicare for all. It's whatever Trump's doing. I don't know. It's not about that. It's not an endorsement for any of that. Two, this is a general overview. Obviously, each insurance company is going to be different. It can be different between different insurance companies. It can be different in the same company, whether you work at, place A or you work at place B. It can be different in the same workplace, whether you work in this office or in this office. What I'm going to do here is just give you an overview, just a general explanation on how your insurance works. If you have any further questions, by all means, you can always contact us, but I would highly recommend you actually contact either your HR or your own insurance company yourself and just ask questions. Just figure out exactly how this works, because in my experience, nobody knows. People walk in here all the time, my insurance covers chiropractic. Do they? I have a copay. Do you? I went to a previous chiropractor and I had to pay this much, or I went to a previous chiropractor and I had to pay this much. So, let's go over a few things. One, cover some vocabulary. Effective date. That is when your insurance starts or resets for the year. Okay? At one point throughout the entire year, everybody's insurance is going to reset. Typically, January 1st. Your deductibles go back to zero. The amount you paid in goes back to zero. Your max out of pocket goes back to zero. Everything goes back to zero. Every now and then, more often than not with teachers, that January 1st date, that'll probably be like a September 1st date. But 90% of the time, it's a pretty safe bet that your effective date, when everything resets, is going to be January 1st, unless you're a teacher or an educator. Two, deductible. What's a deductible? It is a number that's different for everybody. It is the amount you have to pay out of pocket before your insurance will help at all. Could be $1,000, could be $2,500, could be $5,000, could be $10,000. Basically, whatever that deductible number is, that's how much you have to pay of your own money before your insurance will help at all. After your deductible is met, there's something called a co-insurance, typically. More often than not, it's an 80-20 or a 60-40 kind of thing. So let's say you have a $1,000 deductible, you've paid $1,000 worth of medical expenses, cool, now your co-insurance kicks in. Co-insurance, let's say if we do an 80-20, that means anything from $1,001 on, you have to pay 20% of, your insurance company will pay 80% of. Typically. We'll get into that. Copay. Copay is what you have to pay just for walking in the door. Not everybody has a copay, not everybody has a deductible. If you have a copay, in the realm of chiropractic, typically working somewhere in the neighborhood between $30 and I've seen as high as $100. Basically, you walk in the door, you pay that amount, and that covers whatever the chiropractor or the doctor is going to do. It's the amount you have to pay. It is a pre-negotiated rate between the doctor and the insurance company. Now, primary care physician typically has a cheaper copay than a specialist. Chiropractors are considered specialists. So if you look on your card, you might see PCP copay, $10. You might see specialist copay, $60. Chiropractors are going to be considered specialists, just like an orthopedist, probably a dietitian, physical therapist, all that kind of stuff. I talked about coinsurance, max out of pocket. Okay, so you've got your deductible. That's the amount you have to pay out of pocket. You've got your coinsurance. That's the amount that your insurance is going to help you with after your deductible is met. but there's still going to be some that you're going to pay out of pocket. So when you take your pre-deductible out-of-pocket cost plus your co-insurance out-of-pocket cost, you add that together, and then you reach what's called a max out-of-pocket. That's the maximum amount of money you have paid out-of-pocket. Typically, it's like 10 grand plus. Anything beyond that, the insurance company typically will cover 100% of. Cool. So, got that covered. Now, we got some a little more vocabulary. Two big things: in-network versus out-of-network. Tell you right now, in the realm of chiropractic, in my experience, doesn't really matter. If a doctor is in-network, whether it's a chiropractor or your primary care physician, physical, whatever, dentist, whomever, that means they have signed a contract with the insurance company that they will charge XYZ for a given procedure. If I adjust one place in your spine and I'm in network, I've agreed to only charge you this amount. And then the insurance company will reimburse me something else. So I'm getting paid possibly by you and possibly by the insurance company. Now, if I do two things, then I've also got a contract for those two things. If I do three things, I've got a contract for those three things. You throw in an extremity, if I adjust a pinky also, cool, I've contracted that. So basically, if you are in network, the doctor has signed a contract to only accept this much money or this payment from the patient. And in return, the difference, typically not 100% of the difference, will be reimbursed by the insurance company to the doctor. So a doctor could be getting paid from two places. Out of network, doctor has not signed a contract with the insurance company, so he does not have to follow their rules. More often than not, that's a good thing. That means that the doctor and the patient have a relationship, that there is nobody else over here, some mysterious person dictating the care, which is a good thing. Why is it a good thing? Because what will happen is doctor will submit it to the insurance company. In-network insurance company will have somebody who hasn't done the exam on the patient, who hasn't seen the x-rays or anything like that, go, this isn't medically necessary. Patient's in pain. Doctor has proven the patient's in pain, proven that the patient needs work done, and then somebody will just be looking at the form and go, nope, not medically necessary, not covered. Hey, but you're in network. Doesn't matter. If the insurance company says you don't need it, then you don't need it. That makes sense, right? Cool. So, let's do some math. First, example. Want to have some constants, okay? One, let's do a constant of $50 per visit. Some chiropractors charge more, some chiropractors charge less. We're just going to use nice round numbers. Two, let's put together a care plan of 24 visits, okay? Patient walks in the door to the chiropractor does an x-ray, does a thorough exam, does a consultation, putting the whole picture together. He determines, or she, that this patient will be best suited to be treated with 24 chiropractic adjustments. Pretty typical. Cool. So, all right. Fun stuff, right? If you have a copay, meaning you have to pay a set price just for walking in the door, and then the doctor will do whatever the doctor's going to do. If our copay is $30, which even for a specialist I've seen, but that's on the extreme low end. If we're doing $30, doctor recommends 24 visits, that's $720 out of pocket that you, the patient, have to pay to the doctor. Now, it could be done $30 each time you walk in the door. It could just be one lump sum at the beginning. Hey, I'm going to come 24 visits. Cool, might as well just take it all the way. Problem solved. $720, 24 visits, $30 copay. Again, $30 copay, extreme rare, low end, very seldom happen. Chiropractor specialist, more often than not, I'm seeing copays for $50, $60, $75. Like I said, on a rare occasion, I saw a couple for $100. So let's say it's 60, kind of middle of the road specialist copay, times 24 visits. We're looking at $1,440 for the care plan. Again, out the door, because your copay, your chiropractor has signed a contract with the insurance company. That's what he has agreed to collect from you, the patient. $60 each time you walk in. Covers whether I adjust one area or every bone in your spine, throw the pinky in too. Okay, cool. Pretty cut and dry. Now it gets a little hairier. So let's talk about a deductible. Let's say you have a $1,000 deductible. And let's say that from your effective date to your effective date, you have unlimited chiropractic visits. I haven't seen that more than once or twice a year. But for math's sake, you have a $1,000 deductible and you can come as many times as you want. So if we've got that 24 visit care plan, let's say we have the average charge from the chiropractor of $50. So 24 times 50, $1,200. Cool. That would be the cost of the entire plan. Now, you have a $1,000 deductible. So the first $1,000 you pay out of your pocket. After that $1,000, your coinsurance kicks in. Let's say you have an 80-20 coinsurance, meaning anything beyond $1,000, insurance company will pay 80% of, you will pay 20% of. So of that remaining $200 from the $1,200 care plan, insurance will pay 80% of, you are expected to pay 20% of, so you pay $40 of the remaining $200 on top of the $1,000 you've already paid. So this $1,200 care plan, you the patient with the $1,000 deductible will pay $1,040 of. The insurance company will add or take care of the remaining $160 because your insurance covers chiropractic. They pay $160 of a $1,200 plan. Okay, still, pretty basic math, easy to follow. A little hairier still. We're going up a level. This is high level stuff here. Same 24 visit plan. Now what we're going to do is we're going to introduce something called reasonable and customary fees, or the allowed amount. The allowed amount is what the insurance company decides they will pay for a given procedure. So let's say, again, using this example, the chiropractor charges $50 for an adjustment. Well, the insurance company goes, yeah, no, we're going to pay $30 for the adjustment. Leaves the remaining $20. Now, if they're in network, even though the chiropractor has charged $50, he has agreed via contract with the insurance company to accept their responsibility of $30. And the remaining $20 for his clinical expertise is out the window. Doesn't matter. So we're going to take the same 24 visits. We're going to multiply it by, we're going to set the reasonable and customary or the allowed amount at $30. So 24 visits times $30 means we're sitting at $720. Of your $1,000 deductible, your chiropractor has billed out all 24 of those visits to your insurance company for $50. They have chopped his bill. They have taken $20, thrown it away. Doesn't matter. And we're looking at $720 that is allowed to go towards your deductible. $720 out of pocket for you because the chiropractor has only charged you $30 because that's what his contract allowed him to do. So your $1,000 deductible that was met previously in the other example now only has $720 met. You still have $280 remaining, whether it be chiropractic or medicine or dental or whatever. You still have to pay an additional $280 out of pocket before your deductible's met because the insurance company chopped the bill for those reasonable and customary fees. Starting to make a little more sense now. Starting to get a little more clear on the fun games that they play. Let's take it up another level. What's that, Emeril Lagasse? Let's take it up a notch, whatever. Okay, so we've got our $1,000 deductible. Now what we're going to do is we're going to introduce visits allowed. Again, like I said earlier, nobody has a unlimited plan. Not nobody. Very few people have an unlimited visits plan. More often than not, they're given somewhere in the neighborhood of 20 visits per year. And then when that effective date hits, that 20 visits goes back down to zero. So again, let's say we've got our $1,000 deductible and we are allowed 20 visits per year. This is how your insurance company goes, yeah, we totally cover chiropractic. We'll give you 20 visits. Cool. Give you. So we go back to that 24 visits times 50 plan, the $1,200. As we already discovered, that doesn't matter. That's a fantasy because nobody accepts the $50 per visit bill because the insurance company has chopped it away, right? So, doesn't matter. It's fake. Okay, hairy math. We have the 24 visits. Okay, but remember, we're only allowed 20. Meaning the insurance company is only going to pay for 20. So, what we'll do here, we'll take that 20 times our reasonable and customary, or our allowed amount of 30. When the 24, the reasonable and customary, that was $720. Now, since they've taken away 4 visits, and they've taken $20 off the top of the bill, basically that 20 times 30, we're looking at $600. That $600 has gone towards your deductible of your $1,000. So in the past example, where there's $280 remaining for you to still pay out of pocket, now there's $400 remaining for you to still pay out of pocket because your insurance company covers chiropractic. And guess what? So they've put less towards your deductible. They've allowed you 20 visits. When you use those 20 visits, it's done. Anything beyond that, the chiropractor bills it, it doesn't go towards your deductible. It doesn't matter. You've used up your 20 visits. And how much has your insurance company helped you? That much. A big fat zero. But they cover chiropractic. One little cherry on top of this crap sandwich. If you need chiropractic and physical therapy, 95% of the time, they bundle those together. So if your chiropractor says you need 24 visits and your physical therapist says you need 24 visits, 48 visits, and your insurance company goes, you're allowed 20 visits per year. And that combines chiropractic and physical therapy. Oh, and by the way, they're going to send us a bill and we're only going to pay part of it. And we're going to push the rest off onto you because of our reasonable and customary fees. So your 48 visits from the chiropractor and the PT, only 20 of each are taken care of, 10 apiece. But your insurance covers chiropractic and they cover physical therapy. And on top of that, who's got a $1,000 deductible? Nobody. People walking in here, we've got deductibles of at least $2,500, $5,000. I've seen $10,000 deductibles. You've got to lose a leg to meet your deductible. And then after that, they're only going to pay a percentage of it. And that percentage of the entire bill, they're going to actually chop it down because of their reasonable and customary fees. There's literally a lawsuit going on right now where hospitals are suing the current administration to keep their prices secret between insurance companies. Hospitals and insurance companies have negotiated prices, and they're fighting to keep them secret so you don't get to know what they are. I have 2 kids. We've covered this. Frankie was born in a hospital via C-section with an epidural. We had insurance. The total bill was $23,000. Insurance company took care of a big chunk of that. Kelvin was born via C-section with an epidural. Same process. We didn't have insurance. We set up a cash plan. Calvin's birth cost $9,000 out of our pocket. Frankie's birth, the same one, was billed out at $23,000 because that's what the insurance company had negotiated with the hospital. I saw something the other day. A woman had a birth via C-section. She looked at her final bill. The hospital charged her $40 to hold her baby. $40 for skin-to-skin contact. which any OBGYN worth their salt will tell you is a very good thing to do. As soon as your baby's born and cleaned off, mom and baby cuddle, skin to skin, bond. Hospital charge them $40. Well, I should say, build the insurance company $40. Because it's a procedure. It's just a game. It is a game played by people with deep pockets. Deep, deep, deep pockets. In network, out of network, doesn't f***ing matter. Copays, deductibles, doesn't matter. Oh, we cover chiropractic, we cover physical therapy. No, they don't. It's a game. I really hope this has helped, because there are so many people that come in this office that have no idea how their insurance works. Because they make it so complicated and so convoluted. If you have questions, just ask. Call us up. You don't even have to be a patient here. Hey, I don't understand how this works. Doc, can you help me out? Office manager, Juliet, she is a master at this stuff. We'll help you out. We'll figure it out for you. And honestly, best bet, whatever doctor you go to, set up a cash plan. It's going to be the easiest thing for you. Hope we've helped today. I know it was long. I hope it wasn't as boring as I thought it was. But I hope you learned something. You guys have a great rest of your day. I'll see you later.